What is scarlet fever? Scarlet fever is a bacterial illness that develops in some people who have strep throat. Also known as scarlatina, scarlet fever features a bright red rash that covers most of the body. It almost always includes a sore throat and a high fever. What are the symptoms and early signs of scarlet fever? Scarlet fever, caused by the group E. streptococcus bacteria, usually begins with a high fever and a sore throat. One of the earliest and most distinctive signs is a red rash that feels like sandpaper, typically starting on the chest and abdomen before spreading to other parts of the body. This rash often appears within 12 to 48 hours after the initial fever. The face might appear flushed, except for a pale area around the mouth. Another characteristic symptom is a strawberry tongue where the tongue appears red and bumpy. Other symptoms can include headaches, nausea, vomiting, swollen lymph nodes in the neck, and sometimes chills and abdominal pain. Recognizing these symptoms early and seeking medical treatment is important to prevent potential complications. How scarlet fever affects your body? Scarlet fever affects the body by causing an infection that starts with a sore throat and high fever. The group E. streptococcus bacteria release toxins, leading to a red rash that feels like sandpaper and a strawberry tongue. Swollen lymph nodes, particularly in the neck, and general symptoms like headaches, nausea, and muscle aches are common. If untreated, scarlet fever can lead to serious complications such as rheumatic fever, kidney disease, ear infections, and pneumonia. Early diagnosis and antibiotic treatment are essential to prevent these issues and ensure recovery. What are the complications of scarlet fever? Scarlet fever can lead to several serious complications if not treated promptly. One of the most severe is rheumatic fever, which can cause lasting damage to the heart, joints, and nervous system. Another potential complication is post-streptococcal glomerulonephritis, a type of kidney disease that can occur after the infection. Scarlet fever can also result in ear infections, throat abscesses, pneumonia, and sinus infections. Additionally, the bacteria can spread to other parts of the body, leading to conditions such as meningitis or sepsis, both of which are life-threatening. Early treatment with antibiotics is crucial to prevent these complications. How scarlet fever is treated? Scarlet fever is primarily treated with antibiotics, usually penicillin or amoxicillin. These medications help eliminate the group E. streptococcus bacteria causing the infection and prevent complications. It is important to complete the full course of antibiotics even if symptoms improve early to ensure the infection is fully eradicated. In addition to antibiotics, treatment also focuses on relieving symptoms. Over-the-counter pain relievers like acetaminophen or ibuprofen can reduce fever and alleviate throat pain. Drinking plenty of fluids, resting, and using throat lozenges or warm saltwater gargles can also provide comfort. Maintaining good hygiene is important to prevent spreading the infection to others. This includes regular hand washing, not sharing eating utensils, and covering the mouth and nose when coughing or sneezing. With prompt and appropriate treatment, most people recover from scarlet fever without any long-term problems. What are the causes of scarlet fever? Scarlet fever comes from the same bacteria that cause strep throat, called group E. streptococcus. These bacteria release a toxin that creates the rash and red tongue in scarlet fever. It spreads when an infected person coughs or sneezes, and symptoms usually appear 2 to 4 days after exposure. How is scarlet fever diagnosed? Scarlet fever is often diagnosed based on its typical symptoms. Doctors may also conduct a rapid strep test, which involves swabbing the throat to check for streptococcus bacteria. However, this test may not always provide a definitive result. If streptococcus bacteria are detected, it's likely they're causing the symptoms. If the test is negative, further testing may be needed, such as sending a sample to a lab for more accurate results. These lab results usually take 1 or 2 days to come back. Why do some people get scarlet fever and others don't? The susceptibility to scarlet fever varies due to several factors, including individual immune responses, exposure levels, and genetic predisposition. Scarlet fever is caused by the group E. streptococcus bacteria, which spread through respiratory droplets. People in close contact with an infected person, such as family members or classmates, are at higher risk of contracting the bacteria, especially in crowded environments. The strength and effectiveness of an individual's immune system play a significant role. Some immune systems can effectively fight off the bacteria before it causes an infection. Children, whose immune systems are still developing, are more susceptible to scarlet fever than adults. Previous exposure to the bacteria can also influence immunity, as those who have been exposed to similar strains may have developed antibodies offering protection. However, immunity to one strain doesn't guarantee immunity to another. Genetic factors can affect how the immune system responds, making some individuals more susceptible to group E. streptococcus infections. Good hygiene practices, such as frequent hand washing and covering the mouth when coughing or sneezing, significantly reduces the risk of spreading or contracting the bacteria. Additionally, individuals with compromised immune systems or underlying health conditions are more susceptible to infections, including scarlet fever. Maintaining overall health through a balanced diet, regular exercise, and adequate rest can help bolster the immune system's ability to fight off infections. Understanding these factors explains why some people are more prone to scarlet fever, while others remain unaffected despite exposure.